Good afternoon. This is case number 7895, Chicago, Illinois. My name is Mariah Thomas. I have the pleasure to be the caseworker for Ms. Georgia. She is currently a resident inside an independent living community. Georgia was placed inside of this community by her family who wanted to get her 24-hour care. Georgia is currently 76 years old and was living with her daughter and grandson Jack prior to becoming a resident here at the independent living community. Georgia's daughter is an on-call surgeon at a hospital, and her grandson is only 12 years old. With the uncertainty of when her daughter would need to report to the hospital, she decided her mother would need care from a facility who could give her care around the clock as she needs it. Her daughter consulted her other family members and her siblings as well, and everyone agreed it would be in Georgia's best interest to have her within a community. Georgia's other sons and daughters all live out of state, but they make frequent visits to her on the weekends. What has begun to raise concerns for Georgia's family is that she referred to her grandson Jack as David, who is his father, also Georgia's son-in-law. She also does not seem to remember the family visits each weekend. Each time they come, she greets them as if it's their first time meeting. When Georgia had her 75th birthday celebration, her family noticed her decline in movement and memory began to decrease. Her daughter picked out shoes for her to wear for evening out as they were going to celebrate her birthday. She noticed she did not put her shoes on, and also she had no undergarments under her dress when they came to pick her up. That really made Georgia's daughter believe her mother was forgetting things she had never forgotten in the past. Now we are here in the present time, and Georgia's nurses have informed her daughter that Georgia has shown more signs of forgetfulness in the past few weeks. Georgia on occasion misses afternoon lunches that are set aside for the residents, and she left her front door open all night long. These are new signs that have come up that are not like Georgia at all. After close evaluation of Georgia and her recent behaviors, I can confirm she has exemplified signs of dementia. Signs and symptoms of dementia. Dementia is described as deteriorations of cognitive abilities to the point that functioning becomes impaired. With all the forgetfulness and referring to her grandson as someone else, Georgia was showing the beginning signs of this disorder. More recent signs have come up and developed, including easy irritability, anxious behavior, and occasional depression. The early sign of the decline around her 75th birthday is where the subtle cognitive and behavioral deficits began to emerge. More serious symptoms have now occurred, and I have been informed this news by her nurses. The most severe symptom is that she is experiencing more memory loss and apathy. Considering so, Georgia is experiencing Alzheimer's as a major form of dementia. It is with a heavy heart to conclude that even with much research and clinical study over 100 years, there is no cure, nor treatments, nor proper protocols following dementia. There are medications that would possibly slow down the decline of the patient, but brain cells and memory cannot be restored. For the best solution is to continue loving and caring and keeping close care for their loved one. For those who would consider, psychotherapy is also put in place for patients as well as their families to handle the effects of this disease. Thank you for listening.